Hello. Cheers.
Cheers. Well, welcome to Coffee and Childbirth. Dr. Daniels,
Yes.
Dr. Kelsey, because you're cool.
We've established that.
And Dr. Ree, also known as Dr. Wee.
Oh, yeah.
I get that, my little one. Dr.
little
Wee. Is what I get.
So we are here today to talk a little bit about, we're going to talk a little bit about VBAC, some of our perspectives, and that was brought up to you. You kind of had a moment with a podcast where you're thinking about that. And then we're also going to touch on with VBAC. It's really, really kind of convoluted, intense conversation, but part of that is understanding what your concerns are as a birthing mom and how you access that support. And so we will highlight the Rock Your Registry event coming up in June.
Very important.
With a panel of various providers that have experience with the VBAC or at least support you through that. So I'm going to let you go ahead and take away with what you were saying, the podcast you were listening to.
Well, thank you. I just, as a chiropractor, I get asked a lot about VBAC. Maybe we should talk about what is VBAC.
So, and the podcast that you were listening to when you had this thought this week was, what was it called?
The title of the podcast, it was VBAC and cesarean.
Okay.
Benefits and risks.
Okay. And then it was
podcast, the Birthing Instincts with Dr. Stewart and midwife Bliss.
So it was theirs. Okay, gotcha.
Yeah, it's there. It's like basically us, but it's an OB and a midwife, and they work together now. And so if you're in the birthing world, I think he's very well known now, by now. But he was a traditional, conventional, very medically minded, surgically minded OB when he started, and then he started questioning kind of his methods and kind of what was asked of him to do in the hospital. We have to remember, hospital's also a business nowadays.
Absolutely.
It's not really a place just for people go and heal. It's just not, that's not really the reason why.
It has morphed.
Yeah, it has morphed a lot over the century, and now it's very much so business. Lots of board members and executors that
marketing
aspects, money, and then
is different, right? Versus like just coming to the hospital you help.
And then their partnership with so many health insurance companies, which I never called it. Like, I hate calling it health insurance because they're not really paying for your health. They're paying for you to be sick.
It's sick care.
Sick care.
Not
sick insurance is what I usually call it. So anyway, I listen to a lot of podcasts. Politics to health care to economics, finance. I listen to all kinds. I don't know. I think maybe that's why I'm so tired at times, because I listen too much of podcasts.
Mine are a mix of more fun than that.
And remember my story on my way to California? My friend was like, "You really should just you're gonna sit there and just not think about anything, because you think
read some trash magazine,
just trash magazine,
like People magazine."
Yes. So then I go to a bookstore in the airport, and I'm like standing and looking at this giant wall of magazines, and I'm like, that's not practical in my life. Oh, celebrities.
You don't want to read about a Lambo?
No. And I'm seeing all these. It's just like, oh God, this is not useful information in my life. And then I was about to turn around, and I go, autism. So I grabbed it so excitingly, and I'm so proud of myself for having a magazine and in the airport, and I sit waiting for my flight. And I'm like reading about autism and the newest information about it. And I'm like, and then I start laughing at myself, go, this is probably not what my friend was saying that I should grab. So anyway, so that was, and then Maple, of course, was joining me in that laughter. She was laughing at me.
You. Yeah, kids often do that.
Yeah. So anyway, so I'm listening to this podcast, and Dr. Stewart, I don't know too much about what his career was like, but he definitely, at least from the podcast that he was speaking. So I was listening to the podcast. So it's called Birthing Instinct, if I have not mentioned that.
Okay.
It's a great podcast. They have all kinds of guests on it. Anyway, so I'm listening to this one episode, and it was about VBAC and basically the benefits and risks of it. And, Dr. Stewart's experience in the conventional hospital setting. I think he said 28 years. In it, and he finally kind of had enough of it and left. And fast forward, he's now doing a lot of work with lots of midwives and I think doulas too. And he's a big name in that community, I guess. But he shared his view on how the hospital, because hospital is, now we know it's really a business too. It's not the same.
Just like we are, just like it's,
But it's a different level because they're partnership with pharmaceutical companies. They're partnerships with all these so-called health insurance, companies.
They're in contract.
They're in contract. They dictate the care. And they dictate what their policies are in the hospitals.
And their liabilities.
Which
is the biggest challenge.
Correct. And I think also, he also mentioned something about how, by law, ethically and by law, because the hospital's policy is XYZ. For example, VBAC would be like, well, if you already had a VBAC, for sure we're going to do, if you already had a C-section, 100% you're going to have to do a recommended C-section, right? And then third birth, fourth birth, doesn't matter, like every single time. And if the OB kind of says, no, I think we can do a VBAC, right? Then the liability falls on the doctor. So when that happens, what does the doctor do in the hospital? Well, I guess I better I don't want to lose my job.
Yeah, because if they're
my license.
Understandably so, if you're one person in the hospital, there's probably mountains of paperwork, information, legal. They have a legal team. They have all of that. So if you make that decision to go rogue within that system, you then are at fault, potentially at fault for that to happen. So it's scary.
It's so scary.
So of course you're going to go with the person who's going to have more support in case something goes wrong or not the way that you would want it to go, or the person birthing mom wants it to go, or whatever. And so that's the challenge of that system. Just a refresher for anybody listening who is newer to that acronym. It's vaginal birth after C-section. Could be one, could be multiple. Most of the time that is implied that it's going to be in the hospital. Because if you have an HBAC, so home birth or home after C-section, HBAC, home birth after C-section, then that's more of kind of a different animal as well, and understanding what you're entering into there, which can still be a great experience. But yes, to Dr. Stu's point and your point of it is challenging in that scenario to really know what your options are as the person providing that, as the OB providing that, and then also even as the person, as a patient going in and being like, oh, well, they wouldn't, they wouldn't let me. And it's that sucks. But also,
and he talks about that too.
It really is awful, but you have to go in understanding what what their C-section rates are, which to my knowledge, that is public information. Have I looked that up recently? No, but I always tell clients that you can look that up.
It is public information.
It's public information to know.
But that's not what moms are thinking about. That's not their concern.
The nursery color. I'm not thinking about a freaking law degree that
they're
I
like,
need to have.
Let me look at the data on, that is not what most moms especially if they're not in the industry of healthcare either. It's like really not what they're more concerned about, like just day-to-day stuff, especially if they've got a toddler already.
Yes.
Right. And that's what's happening.
So it's really hard.
It's really hard. And so they go to practitioners that are small timers like us.
Sure.
Right.
Sure.
And they get answers from us, and it's going to get a different answer from a hospital setting.
Right.
Obviously. Totally different.
Confusing.
It's very confusing for moms. And then, it's just really all comes down to like how strong is that mom to like stand up for herself as well. That's a big factor too. And resources and support that she has. And then, and sometimes if you're a first time mom, oh my God, they told me that I have to have a C-section. What do? You just go, okay, well, I guess that's what's happening. And then now you're ruining your chance of having vaginal birth. The rate of that, or the percentage of you having a vaginal birth after that, is significantly lower. And not to mention, as a chiropractor, as a physical therapist, what do we see? We see the aftermath of that, right? Like, and Dr. Stewart talks about that in regards to the policy that the hospitals can have, and then
what they're limited to,
but also the law. Like you can't say, oh, just because the mom says, no, I really want to do a vaginal birth after my last C-section. And then the hospital policy, which includes, unfortunately, the OB, right? And
you're all, when you register, you're
signing up for that. All those fine prints.
I did it twice.
Yeah, the fine prints that you are not reading.
I don't want to read that.
You're agreeing to their policy, right? And so it's really difficult for everybody in the boat.
It is. It's a tricky
policy.
Scenario because of education, not like college education, but
you're talking about the indoctrination of it?
Kind of, yeah. Okay. How information is passed from your parents or your mom's,
I see.
Your mom's, auntie's, sister, whatever, all that information that you're getting as a person to then understand, should I be asking this question? If I ask this question, what's the answer going to be? Am I ready for that answer? I don't really know if I'm ready for that answer. And then most of that is buried under so much that you don't even know to get to that point.
Right.
So part of even why we are having the event in June, Rock Your Registry, and having that conversation of things like a VBAC, things like a home birth, things like a elective C-section, what you're purchasing for yourself, what you're investing for yourself can be in very different ways.
Right.
If you have 3 moms sitting in front of you in that audience, they may not necessarily all prepare the same way. Yeah. But my hope as a provider is that they're able, as a physical therapist for them, they're able to feel like they did what they needed to do and what felt right for them. But you can't really make that choice if you only are in one system. Right. We have to kind of see the lay of the land and the network of it all, and the ecosystem of it all. So that's why we're both excited about that event, but I'm excited because I've seen so many moms have an opportunity to, with ones I've done in the past that are small, be like, oh, I want to ask you this question, or ask another mom this question. They don't even have to ask me. Right. They could just ask another mom that question. Yeah. Or maybe afterwards, and they have like a 6-month-old, and they're like, I didn't realize I'm ready to talk more about this because I may have a baby in the future. Or maybe you won't, but you're still like, I kind of want to talk more about my health at this point and what I can do. And it's like, okay, well, here's options.
We're creating that community.
Yes.
The village.
Exactly.
Our village.
I saw
Women's village.
Bag the other day that said, I took a picture of it. Did you? That said, I was told there would be a village.
Oh.
Like on the bag. I was like, I was told, there'd be snacks. Where's the snacks?
We are providing snacks.
We are providing snacks at the event. We're going to have some mocktails and some snacks.
Yes.
But it was I was like, man, maybe you should put that on the bag, because it was very true. Like,
I love it.
Where's the village?
Yeah.
Did I not sign
where's
up?
The clan? I like the clan, the village, all of those words apply.
Yeah. So we have a little bit of time left here. I would love to dive into kind of that information specifically, like you were saying, with So what he was saying was that it's a challenging situation for the provider and for the patient, right?
Well, yeah, everybody's everybody that's involved. I think the hospital they're so disconnected to their patient, right? The hospital, in regards to the business side of it, the executors and the board members, they're not there. They don't see the day-to-day lives of their patients. That's not what they're worried about. They're worried about the bottom line, number and finances. That's really what they're worried about. And then how that all kind of works with the major pharmaceutical drug companies and their insurance companies. So how that works, that's what their first concerns are. And then the second level is really all the doctors that's involved in that hospital, right? And some
doing the actual treatment.
Yeah, some may be like, I don't think I want to drink the Kool-Aid anymore, right? And they're just like lost themselves in that, because they know inherently that what they're doing doesn't feel right, but they don't know what the other options are, because that's all they've been indoctrinated to think. And I've got lots of medical doctor friends, in LA, and I see it, and it's kind of sad, because they're exhausted and kind of mentally just confused, but they're just living in it. Somebody said, oh yeah, I took the red pill and I was out of there, and
that can be too, the reality of making that shift might not be possible.
No,
likely is not.
Of course
possible
not
for everybody. And that's,
as an individual,
the most depressing part.
Yeah, and as a practitioner or provider in the hospital setting, nurses and everybody, technicians, to everybody, their day-to-day income is to be in that system. And if they don't know anything better than that, even though inherently in their heart they're like, something's not right, but then you just live that life because that's where they're at, and you can't blame them for that, right? That's the life that they are in, and that's the world that they see. So then when you see moms having to feel that they have to participate in it, and they are not provided with information that's outside. I mean, like we just talked about tongue release.
Oh yeah, I know. I almost wanted to talk about.
Oh,
that
there's
today,
so many things.
But I was like,
I want to talk about autism too, but we got lots of stuff.
Yeah.
So the backwardness of it, right? Because if you really think about how the body heals, the body heals from the inside. You can put a Band-Aid on externally all you want. That's not what's healing the scars, right?
Yeah. Or even preparing. So when it comes to birth and that concept of how are we, so it's not inherently that vaginal birth after C-section or VBACs are impossible. It's not inherently that they're only good, or it's not inherent that C-sections are bad.
Yeah.
There's a lot of nuance in birth itself.
Well, it's overly prescribed, the C-section, and then there's more money for insurance to pay out when it's surgical, right?
Well, there's less time that they're spending.
Right. So time per service.
Well. Yeah.
Right.
And
money per.
You're not doing nursing, staffing for the entire 15 hours prior to labor. You're not admitting them for early labor. And so you're just coming in, you're doing this procedure, and they're exiting. You're not necessarily having the same aftercare.
It's a whole different ballgame.
It's a whole different ballgame. And that would be so interesting to see the data on that, or just have people, because we know that inherently from how we know, or at least like my experience when I was in a third party payer system, my experience of that, understanding that intimately. But it would be awesome to see how that actually shakes out, because it's really it's not a conspiracy that's happening. Like it really is. If you look at the numbers of what that is, that's how it works out. You don't it's just like,
that's the reality of it.
The reality of it. And the event, like if you have an event that's happening, you have to have staff for it. You have to have whatever, versus if you have this webinar that's happening where you don't have the overhead of that staff. You don't have the overhead of that additional food, that additional medication, you have whatever. So that's where like it'd be awesome to see. I know that that's out there on the internet somewhere.
Yeah, of course.
I know it is. I just haven't necessarily.
I mean, as a business owner, we
That's
also
exactly.
right.
It's
We
like,
even though we're a small time, we don't have a bunch of like executive board members, right? I mean, we also do need to look at like our service per time, right? Per income, right? Revenue. And so, yes, I understand that part very much. For sure. You know, I have experience with big corporation in the past, not as a chiropractor, but I owned an Arco AMPM.
Yeah.
That's a big time corporation that's worldwide. And so the way I had to deal with them, it just taught me and understood, it gave me the ability to understand how that like level of corporation runs their business. So efficiency, right? Productivity,
you have to stay alive.
100%. That's part of life.
Yeah.
I guess the VBAC situation, and I want to always try to advocate for my moms.
Sure, of course.
I feel like that's going to be priority for me. So when I want to see it from their perspective, try to minimize the confusion. Right. Also give them the information for them to make an informed decision, which is very much so missing. And Dr. Stewart, I think, mentioned something about that. They provide the mothers a skewed understanding, right, of the information, the data. And they say, well, if you have a C-section, the chances are of you having a safe vaginal delivery, it's like all these awful things can happen to you. And then you scare the mothers instead of empowering them and saying, okay, this can happen, but what can we do differently from today to the point of you delivering this baby? Totally different. And it could be like when the mom's not even yet pregnant. Like this is the conversation that they're having with their first C-section. And saying, just so you know, you are going to probably hemorrhage on my table if you have a vaginal birth after having this C-section. Maybe 2 years later or 3 years later for your second born or your third born. And Dr. Stewart talks about the exponential number of women that actually has, I think it was some sort of hemorrhage. I forget what the condition was, but there's all these awful medical conditions that they have to deal with. Each time, it increases each time that they have a C-section. Right? And let's talk about the actual scarring. Not just externally. Yes, it's an external scar that you're going to see. But what about the internal scars?
Right. So not the conversation is definitely not that C-section is underprescribed.
Correct.
So I would agree that it's overprescribed. What's interesting, in my opinion, when it comes to what information, like you said, people get as they're preparing for VBAC. So let's say a C-section happened for indicated reasons across the board. We agree with that. The OB agrees with that. The client agrees with that. Okay. No questions there. But now we've arrived at this mom who is 3 months pregnant with her second child. 3 years later, we'll use 3 years later, and she has no actual preparedness for what a VBAC potentially is. And whether that's something she actually wants to embark on. Because in my opinion, as a PT, what I see with someone who wants a VBAC is that it requires so much mental preparation, even more so than potentially your medical preparation.
Like physical preparation, medical preparation.
Because you are navigating, especially, and like I said, if you're having a home birth after C-section, totally different animal. You're going to be, those people are going to be supporting you in a way that is incredible, because that level jump is so big from a hospital situation to a home birth situation. Even if it was a vaginal birth, they're going to be like, we want to make sure our numbers are great, because they really are invested in you having a successful home birth after C-section. When it comes to a VBAC, you're in a hospital situation where the easiest thing that they have access to, which is again, not necessarily to their fault, but that's where they are. Easiest they have is to do another C-section.
Yeah.
They don't necessarily have the same investment or skin in the game,
of course,
to not to have you be a successful VBAC person.
Yeah, and it also comes down to control.
Sure.
Controlled setting.
Sure.
Right?
So it's like you're preparing for
Yeah.
in a VBAC, you are really preparing your ability to understand what birth is. You're starting over, and you're starting over in a scenario that is, it's very possible to have this happen, but you have to know what a bishop score is. You have to know what your policies are.
Yeah.
You have to take a hospital tour and then do childbirth
outside
of that hospital. You have to see us. You have to do, you have a chance
the commitment
to do all these things, which will definitely change your trajectory in a positive way.
Yeah.
But you're not just going in and telling that nurse on staff when you're 4 centimeters dilated, oh, hey, by the way, I'm going to have a VBAC today.
Yeah, that's not
happening. You're not going to have a VBAC if that's you're with no doula, with no nothing, nothing.
No advocate. No,
you're like, I was here 3 years ago and I had a C-section, but we're gonna.
That's not happening.
Sherry, we're gonna have a VBAC today. That's not happening. That'd be cool.
Okay.
Please, if you had that happen,
we would love to know
where that happened. Amazing.
Yeah.
But it's just the reality of that is what is kind of so disappointing.
Yeah.
We have a lot of opportunity to support. There's a lot of options for people in that scenario, but it's an interesting, I'm glad we've talked. That's why I was like, we should talk about this today, because it really is a point of saying it's a different experience. Just want you to know that entirely possible, but that's the empowerment. Versus just being like, oh, go to this hospital because it's going to be great.
Just show up.
Just don't.
Yeah.
You can't.
Yeah.
Do that.
Yeah.
And so one of the ways you could come hang out with us in June.
Yes.
To be able to understand a little more of that and why we kind of have that strong feeling.
Yeah.
Is there anything else
passionate feeling about it?
Well,
I'm excited about meeting more, because I'm still I feel like I'm still trying to connect with a lot of the practitioners here in Las Vegas. I think the Rocket Registry event is going to give me the opportunity to just kind of get a bigger understanding of the network of these practitioners who are supporting this side of not just pregnancy itself, but just postpartum care for the women, right? And we have a lot of connection for even the children, but I would say probably just to help moms navigate through that, and I'm hoping also preconception, that's going to be a big part of it too. I'm hoping to see more women who are not even thinking about pregnancy, but then if they do show up, I'm like, oh, maybe this is something that I should prepare for prior to getting married, or prior to wanting to have kids or another one, or and get them, kind of educated in that.
Yeah, because ultimately
and then the spectrum of people we're going to have on the panel, I think that's going to be really great, because some people are going to gravitate one way or another. So I think that's going to be really cool. And so please, share the word, word of mouth. Grab your tickets.
They're
ASAP.
live.
Yeah. Oh, are they live now?
They're live.
Okay. You're amazing.
They're live.
It's alive. Yeah. So I think I'm excited for that. I saw the mini version of what you were doing before, which was great.
Yep.
I'm excited about, and I'm excited about how this is going to all kind of come together, and then how it's going to grow, because there's always room for growth, obviously,
and evolve and change to include that aspect. So thank you so much. Thank you for hanging out with us, and if you have questions or comments, please let us know. And then also,
best way to let them for you to kind of connect with us will be our Instagram page, right? Coffee and Childbirth. On Instagram, please connect us there, and you'll be able to send us DMs or questions or concerns or just your thoughts.
And we will see you next time.
Have a good day.
Bye.